Hello everyone, happy World Cancer Day. My name is Dr Hafsa Waseela Abbas, and the aim of today's lecture is to provide an insight into patient-centered care. So the aim of this lecture is to first introduce the aims and objectives of the World Cancer Day campaign, to provide an insight into patient care and why is it important, to discuss some of the issues within patient care and how can this be overcome, how can this be resolved. So when we talk about cancer, why is raising awareness about cancer important? And this can only be answered through the statistics that are alarming and have been released by the World Health Organization and World Cancer Day. 1 in 5 people developed cancer in their lives. And in 2022, 1 in 9 men and 1 in 12 women passed away from cancer. There are also approximately 20 million new cases of cancer in 2022. And it has claimed 9.7 million lives in cancer care, with an annual economic impact of more than $1 trillion. Now, these statistics are globally. However, when we reflect in terms of the UK, Cancer Research UK have released several statistics between 2017 and 2019. Did you know that there are 385,477 new cases of cancer, where 167,142 of these cases have actually led to deaths? Did you actually know that within the UK, 50% of these cases have survived cancer for a decade or more in England and Wales? And did you know in 2015, 38% of these cases are actually preventable? So this highlights the need, the urgency to raise awareness about cancer, because it can happen to anyone, regardless of age, regardless of socioeconomic background, regardless of how much exercise you do, how healthy you eat, even if you actually work in a healthy environment where there's a lot of green scenery and no toxic chemical exposure. Everyone is at risk, okay? And this is why being aware of signs, of symptoms, and partaking in the screening programs, it's important to highlight and raise awareness. So the aim of today's lecture is to focus on World Cancer Day. Now, World Cancer Day was been founded in 2000, and it's led by the Union for International Cancer Control, UICC. And how it aims to raise awareness about cancer and its importance is through campaigns about equity, raising awareness about the global understanding of cancer, and contributing to research within treatments and how it is being diagnosed, and this will help increase the survival rates. And this not only takes place within the social media, they also do it in educational institutions, through unified actions, places of worship, community centers, health centers, and this creates a unified message of how every single person has responsibility, has a role to play in lowering the cancer rates and increasing the survival rates. And the new campaign that they have started this year, and it will finish in 2027, is UnitedByUnique. And the aim of this campaign is to recognize that every single person, every single cancer patient has unique needs, has unique stories, and also has the unique way of thinking. However, we come together in being able to decrease the amount of cancer burden and try to improve the quality of life. And this is why they are focusing about people-centered care. So what is the aim of each year? So in 2025, they want to hear stories about cancer patients, cancer survivors, family and friends, advocates, about the stories related to cancer. And this will help understand and know how people vary in their needs. Then in 2026, they will try to see how these stories can affect and change the mindsets, especially those who have the power to make the change, whether within the government, whether in the healthcare organizations. And in 2027, the aim is to ensure that these words, these emotions, and these stories do not flow away. Rather, action is being done, and these actions require a steady process, whether locally, whether nationally, and whether globally, to highlight the importance of people-centered care. And this is what leads to a united success. So now I'm going to progress on to what is FST. So FST is a volunteer community-led group where we aim to help, inspire and educate. So Thyroid Cancer Project is one of the branches of this tree, and the aim of Thyroid Cancer Project is to raise awareness about cancer, and this is achieved through articles, quizzes, information posters, raising money for cancer charities, and much more. We also have free cancer courses, and this will help not only those in the public, but also those within the field of health and science to understand and the basics of cancer care. Now, as part of World Cancer Day campaign, we aim to help and promote on a World Cancer Day campaign on a weekly basis through our humble small network. And we have designed a range of projects to help with sharing these stories, uniting in raising awareness about cancer. The first is the inspiring poetry book, and this aims to poetically express people's journey about cancer, okay? How it can help to connect, how it helps to contemplate and reflect, how it helps to boost and improve the mood of those who have cancer, those who previously have cancer, those who treat cancer patients, and those who know someone who has cancer. And this is a form of creativity and also a form of encouragement. Art without words. Sometimes we do not know how to express how we actually feel through words. And sometimes drawing can help in terms of expression. And when we look at an image or a piece of art or a piece of painting, we are able to see things differently. So what one person sees is not what another person actually sees. And this is why color, form, shape, structure can all be interpreted differently from one person to another. And every person has a unique journey, unique needs. But we can come together to create a global message of raising awareness about cancer. And it's important to understand not everything can be shared. Okay. Because sometimes, even if you see an image or draw, even if you actually write and share it publicly, it won't actually help in terms of expressing fully. Some things need to be kept within you, whether you're a cancer patient, relative, or a friend of a cancer patient. And this is where the third initiative, which is the 365 notebook, comes into play, because it will help to jot down thoughts without being judged, and it allows to set the hearts, the minds and the souls freely, because this notebook will be actually kept with you, and each day you can write and set new objectives, set new challenges. We've also been invited by the Unity FM, by dear respected Kathleen Rochinagi, and on her show we hope that we can raise the public awareness about cancer and why it's important to volunteer and contribute to World Cancer Day, because World Cancer Day work with a number of healthcare centers, healthcare organization, and if we need to make a message on the importance of cancer awareness, then it's important to contribute to their cause, because it collectively, when we work together, we are able to make tomorrow a brighter day. So what is actually patient-centered care? Now, the World Cancer Day has defined patient-centered care as focusing on the individual as a patient within the healthcare system. So what that involves is understanding the patients, how they actually feel, involving them in terms of the tests, the procedures, breaking down information to them so they know what type of cancer it is, what are the risks within the procedures. So and also give a form of encouragement where they have the control, the right on on the health condition. Person-centered care is to consider the individual holistically. So this not only involves the health side, but also the emotional, the physical, the social, the spiritual. So it's like a broader context of the life. People-centered care is about prioritizing healthcare around the people and communities rather than the diseases. And this can be done through information being shared that meet the level. It can also help build trust between a doctor and patient relationship. And the trust between a doctor and patient relationship depends on the number of years and how well they actually understand each other. So why is patient care important? So patient-centered care is not only involved within the clinical settings, but also the research settings. And besides the elements of trust, it's also about patience, it's also about understanding and how effective the communication in the messaging is being given. And it gives them a chance to ask questions. It gives them a chance to process their emotions. And this is vital because currently the aging population is increasing, the patient population is increasing. And as they are increasing, the research side within the cancer care is also improving because there's a lot of different diagnostic tests that are being developed, new treatments that are also being done to help minimize any side effects and also raise into minimizing risk factors. So what are the current challenges within patient care? And the most important challenge is the emotional state of the actual cancer patient, because you are actually cancer is a life-threatening, and it can turn your life upside down when you kind of open your eyes and realize, okay, this is actually happening. Okay, I won't be able to process my emotions, straight away. Some will take time to digest this, and some would act on the spot to try and think about what they're planning on to do next. And it can change their behavior regardless, because you come to realize that there are things that you want to achieve more. So there's prioritization. You start to think about your friends, your families, your studies, your work, your goals, and it comes to a stage that, okay, am I going to let cancer turn my life upside down, or am I going to fight cancer? And this is the most important challenge, is the processing time, and the need to overcome this requires the support of the friends, the family, to overcome this pain, especially as you go through the diagnosis, waiting for the results, as you go through the different types of treatments, the agony of the chemotherapy, the radiotherapy, the surgery, wanting to know, have all the cancer has been removed. All of these can have an emotional effect, and this is why the need for support is vital. So besides the family, the friends, the healthcare professional has the most important task, and which is to try and involve the patient as much as possible within the care planning. And this depends on how much training they have had, their experiences, and also medical research, because it goes hand in hand. The patient depends on the healthcare professional's knowledge, okay, and experience, and physicians need to present this, and this will what strengthens the doctor and patient relationship, and it also helps the patient to adhere to the treatment. Other contributory factors is increasing the patient autonomy. And the World Cancer Day have shared some reports that people-centered care, politically, economically, on a global level, at national level, there's a misunderstanding, there's a gap there. And this is why this campaign is needed, so they are able to overcome these limitations and understand the importance of people-centered care. So when we reflect in terms of involving the patient within the care planning, this varies in terms of a number of factors: age, gender, ethnicity, religion, level of education, clinical history, and also type of relationship. So the most important step within patient-centered care is a preparation stage. How will one be able to offer that support? So the most crucial factor is being open. Okay. Having an open character will help the cancer patient to express how they feel. And how open you are will depend how much information will be actually shared. But at the same time, we don't want the cancer patient or the relative or the friend with cancer to always think about cancer, okay? Because it will cause a form of distress. And therefore, to discuss other things besides cancer, for instance, sports or hobbies or you know, anything that you may know that the cancer relative or friend enjoys discussing about. This will help take the mind off things. At the same time, you don't want the conversations to be too generalized, because then it will kind of give them a signal that, okay, this person doesn't actually care about how my health is or how am I progressing with my health. And therefore, this is why a fine balance is needed. In addition to this, is some consider religion is not important to mention. But when you are when your life turns upside down, those who do have a faith will cling on to their faith. Okay. So yes, around the world there are people with a religion, those who don't believe in nothing at all. But so what they actually do when they the downside within the life, it varies from person to person. But those who do have a faith will tend to cling on to their faith as a form of gratitude, a form of contentment, and how every second of each day actually matters. But at the same time, everything requires a balance, because what we don't want to do is overload them with information about religion and so forth. So everything would need to be more optimized. In addition, respecting their privacy, because some days the cancer patient, whether they have a treatment or after they've done a test or a procedure, that they want to speak, okay? But at other times, they may not want to speak. And this is why it's important to respect their privacy. However, as a cancer relative or as a cancer friend, what you can't do is be a listening ear. Okay, being a listening ear where if they called or if they texted or if you've actually visited them and they want somebody to speak with, they need to know that you are there. And it provides them a form of a relief. So this is why a close-knit support is necessary. However, there are other strategies that can be done. For instance, so far we've spoken about a relative, about a friend, but even in the workplace, the manager, or within the educational institution, you know, the lecturer, the personal tutor, or the dean, they have a responsibility to, in terms of the health and safety, what measures need to be done, for instance, what type of tasks, shift patterns, you know, exams, locations, what they need to actually help in terms of mobility, and also I think the most important is to have a form of psychosocial support. So for instance, during the workplace or during the lecture, when you just need some time out or need somebody to speak to, then a mentor has a responsibility to help. However, so far we've spoken to about those who are adults or of various age ranges. However, when we actually speaking to young children with cancer, a more sensitive approach is needed, because what children actually need is honesty. They need to have some form of reassurance and having information being broken down and understanding that they not might be able to play with the toys or play with their Legos and the cars and what they used to do every day, do it as they did before. Even, you know, playing outside. So it won't be regularly, but it will be decreased. But this is needed to inform them. So this honest conversations is vital, and giving the children the chance to ask questions and listening to how they actually feel is essential. So therefore, it varies how you speak with a child and how you speak with an adult. It varies, okay? And the doctor has the important role in doing so, especially how information is being digested, how especially with if it's a young the cancer patient, then the parent or the guardian need to be aware of, you know, the options, ability to ask questions, understanding the next steps. All this is essential in patient care practice. And with time, this is how trust is actually being built. And it will help emotionally, physically, and also socially. However, there have also been studies released where they discovered that involving patients within the decision making is a stressing process, because they have that responsibility of facing that life threatening disease, and the fear, and when you actually overthink, it can lead to confusion and you know, increasing vulnerability. So this is why choosing the actual right time is important. What is being said is important. How is it being said is important, because every single patient has unique needs, has unique ways in being able to deliver the message. So for instance, if a healthcare professional is being trained to speak with a lot of patients, that does not necessarily mean that there's an optimized way in how you actually speak to all actual patients. because it varies. Okay, so each person needs to have a more of an optimized way in how the communication and message is actually being delivered. And as time goes by, there's the introduction of technology, and the NHS application has been vital in being able for patients to manage their appointments. Also, there are electronic ways in being accessing medical records, test results, medication list, and this will give us a sense of patient engagement, especially in cancer care. And there has been reports that those who are cancer patients have the tendency to review these applications more than non-cancer patients, especially during the COVID-19 pandemic. Furthermore, there has been other applications such as Unitire, and this is a form of digital health application where it teaches the patient on how to manage cancer fatigue. How are they able to decrease the side effects, such as with cognitive behavioral therapies, relaxation techniques, and this helps tailor each patient's needs uniquely. Moreover, there are other ways in how to stay up to date with information. For instance, the NHS website, you've got the Cancer Research UK website, there's also the WHO, and many cancer charities and cancer community groups try to provide information with fully validated references. Moving forward, what is being done to help improve patient-centered care, especially in cancer? So the NHS England have announced a reform elective cancer care plan for all patients, and the goal is 92% of patients receiving treatment within 18 weeks. So what do we mean by elective cover? So elective cover involves planned and non-emergency services, and this can be from the tests all the way up to the treatment. There's also trying to utilize diagnostic centers and surgical hubs more smartly through triage systems and optimized diagnostic standards. Also to improve the performance against cancer rating time, and the aim is to achieve a goal of improvement by 5% in March 2025, being able to have treatments done even locally, and this prevents unnecessary follow-up appointments and prioritise patients. There's an increase in the use of artificial intelligence, and it can help patients to make choices and take control, but also it can also help healthcare professionals to assess data and predict the risk of falls, hospital admissions, and appropriate safeguarding procedures. Moreover, promoting patient rights, decreasing health inequalities, reviewing the performance and training of each healthcare professional, Also, there have been a guidance to improve person-centered care, and these have been released by the Royal College of Physicians. And this is where you would avoid medical jargon, giving patients more involvement in care plans, inviting relatives and carers to support patients and making shared decisions. So there are a number of methods being done to support cancer patients, their relatives, their friends, colleagues, and this will help create a unified message of one day, there will be a day where we have a unified message for cancer, and this day is World Cancer Day. Thank you.